Having a voice that matches a person's appearance is very important, especially when transitioning. Amy Carlberg is a speech therapist at Middlesex Health. She joins us today to talk about this topic and how she can help people who are going through the change become more comfortable. Amy, thanks so much for joining me today.
Oh, thanks for having me, Pat. I'm happy to be here.
So tell me, what is it like for someone going through a transition? How does the voice come into play?
So, a lot of my patients tell me that that's one of the biggest factors in their transition, um, because ultimately they might end up transitioning with their appearance, and they might look a certain way, but then a lot of patients will tell me that their voice kind of outs them, right? So, as soon as people hear them start talking, they realize right away that they're transgender, which can be a really uncomfortable experience for people. So my goal is that everyone feels more comfortable with their voice through working with them.
So tell me then, you're saying vocal surgery isn't necessary in all cases, right?
No, not at all. I think vocal retraining or vocal voice therapy is a better option because it's less risky, right? So just like with any surgery, there can be complications. Um, and if patients are able to change their voice through voice therapy and voice retraining, then that's great, right? Because then they can avoid going through a surgery, they can avoid those complications.
So what does it entail when you train somebody?
So ultimately, it ranges depending on the patient, and my sessions tend to be pretty specialized to each patient because everyone's different, right? So we usually work together from anywhere from 8 to 12 weeks, and that can be shorter or longer depending on the person. And then we work on a bunch of different areas. So vocal pitch, kind of that tone of your voice, your resonance, where it kind of vibrates, and then a bunch of other nonverbal factors, which also can make a big difference in kind of masculinizing or feminizing a person's voice.
Is there a fear of speaking when someone's going through a transition?
Definitely. So my patients who are outed when they talk, I think a lot of them report to me that they tend to talk way less because they know that when they talk, it'll out them. Or some of my other patients, when they're working with me, it takes a little while to feel comfortable using a new voice, right? It can be a little bit daunting and scary. We work through a bunch of steps to kind of encourage them to feel more comfortable, right? So I'm not just throwing them into the water. We kind of take it slow and go step by step to try and acclimate them more to using it.
So success can be achieved, and you don't necessarily have to take medications. Is that right?
Right. So a lot of trans men or non-binary people will take medication. Testosterone does a lot for voice. So you might have heard trans masculine people or trans men talking, and you hear their voice deepen a lot when they start taking testosterone. But unfortunately, estrogen really doesn't do much for the voice. So that's kind of where I come in. And also, trans men sometimes don't want to take testosterone or can't. So we kind of work with both trans men and trans women on voice.
What has been the reaction from patients that have worked with you?
So it's been kind of all over, you know. A lot of people will tell me that after working with me, you know, it's challenging, right, to change your voice, but little by little it gets easier. And then after working with me, they're often able to use that voice with other people, right? So with their family members who maybe they didn't feel comfortable talking to, maybe they answer their phone now. And a lot of my patients were just not answering the phone, right? Letting it go to voicemail because they didn't want to be outed right away. And I think that's really powerful that they're able to communicate way more now because they're more comfortable with their voice.
So, what should the expectation be when someone comes in to work with you? What should they expect?
It really depends on the person. Initially, we need to have an evaluation. So they come in, meet with me. We talk kind of about them, their transition, their voice, their expectations, and their goals. Then we kind of go through a bit of an interview process to talk about vocal hygiene. What are their kind of vocal behaviors? So how much water do they drink? Do they smoke? How much do they use their voice? Then we take some measurements on the computer and kind of analyze their voice through all the different parameters. And we kind of develop a treatment plan from there of what we think is achievable. We set some goals and really just kind of see where it takes us.
Vocal health and hydration, very important. Amy Carlberg, speech therapist at Middlesex Health. They're lucky to have you. Thanks so much for joining us today.
Thank you, Pat.